So you treat people that have bite problems that are causing a lot of problems, like a migraine headaches or sore jaw. I mean, what are the
Yes.
symptoms
Well,
then of a?
they're seemingly unrelated. I mean, someone's sitting in my chair, and just by their posture and by the way they hold their jaw, I might ask them, "Okay, do you have neck and shoulder problems?" And they'll look at me kind of funny, like, "How did you know that?" And honestly, it's very very obvious. And then I can follow it up with the different symptoms they're having related to TMD, such as sore muscles, blurry vision, clicking in the jaw, clenching, and grinding. I mean, it's really not hard to pick out once you know what to look for. People go to their dentist and they've been told that they grind their teeth because they have wear, and they think, well, it's not bothering me, it's not a problem. Well, I can tell you it's a problem. It's a huge problem. Down the road, you could lose your teeth. You know, you could be in line for some very expensive dental treatment if it's not addressed.
So you're grinding because why? Because your teeth don't come together properly?
You could be grinding because your teeth don't come together properly. You could be grinding because the muscles are unhappy when your teeth are together, and that's called neuromuscular dentistry, and we address it from a physiologic standpoint. In other words, okay, how do we make those muscles happy? But I can tell you, if this is not addressed early on, and by the way, it affects women more than men, 79% more women. If it's not addressed early on, then you are in for some problems later on the road.
Now tell me this, because migraine headaches can be connected to this TMJ problem. Is that right?
Yeah,
and shoulder pain.
Absolutely.
Well, this was your
Yeah.
topic at
Yeah.
I guess Las Vegas Institute. You taught
Correct.
dentists how to fix this.
Yeah, correct. Now,
Is there a short answer of what the connection is? 'Cause I don't get
let me
How
put
could
it.
your migraine have anything to do with your teeth?
Okay, let me put it this way. There are 12 cranial nerves. It gets slightly technical here for a minute, but bear with me. There are 12 cranial nerves. The one nerve, the fifth cranial nerve, that innervates all these muscles and your bite and all the function associated with this is the fifth cranial nerve. That fifth cranial nerve is responsible for 90% of the input into your brain. 90% of all the input in your brain. So if something is out of whack here, it just plays havoc with your whole body.
So when you fix the bite, you have people that their migraine headaches go away?
Absolutely, when you rebalance everything that's going on with this apparatus, a lot of times we see the migraine headaches go away. We see neck and shoulder pain go away. We see muscle soreness. We see the grinding going away, because when you're grinding, it's because your body's not happy with the position of your jaw. If your teeth are in the way, it's kind of
So you don't grind during the day. You grind when you're asleep.
Yeah, most of the time you grind during your sleep. You have no control. So people will tell me sometimes, you know, I sleep with my mouth open. Oh, well, you do sometimes, but not in REM sleep. You don't. So they think they can stop their grinding. You really can't. It's a non-voluntary response.
So, but it can be fixed.
But it can be fixed.
And you're one of the guys to do it.
And I'm one of the
You're
guys.
the best guy in San Diego to do it?
That's me.
No, but seriously, I mean, you taught dentists from all over the world how to take care of this.
You know, it's amazing. We see in the cases at LVI where we have treated this, patients would come back, and the testimonials that they give of how much better they felt. Because here's the thing about TMD symptoms is they don't just
What
overnight.
does TMD stand for, by the way?
TMD stands for temporomandibular dysfunction, and the layperson usually calls it TMJ.
And that's the joint
That's
right
the
here,
joint,
though.
temporomandibular joint. But you know, we use that term also in dentistry because everyone knows what it means. But the thing about those symptoms, they don't happen overnight. So also, if we eliminate them in one afternoon, they're amazed that, wow, I never knew how bad I felt. Why didn't I do this years ago?